How do fluid irritants affect bladder health? Imagine your bladder as a balloon that holds urine until you're ready to go. What you drink can influence how comfortable or irritated that balloon feels. While staying well hydrated is key for overall health, certain drinks can irritate the bladder lining and cause problems. This is especially true for people with sensitive bladders, overactive bladder, or chronic bladder conditions. Fluid irritants are substances in beverages or foods that can upset the bladder's inner lining. Common culprits include caffeine found in coffee, tea, soda, and even chocolate. Caffeine acts as a stimulant, making the bladder contract more often and increasing urgency. Alcohol is another irritant because it is a diuretic, which means it makes you urinate more and can irritate the bladder tissue. Carbonated drinks like sodas and sparkling waters, even if caffeine-free, can cause irritation in some individuals. Acidic beverages such as orange juice, grapefruit juice, lemonades, and cranberry juice may also irritate the bladder lining, especially if consumed in large amounts. Some artificial sweeteners present in diet sodas or sugar-free products can worsen bladder symptoms for certain people. Additionally, spicy foods and highly acidic fruits can irritate the bladder when eaten excessively. When you consume these irritants, they can cause your bladder muscles to contract more frequently or strongly, leading to feelings of urgency or needing to urinate often. They may also directly irritate the bladder lining, causing discomfort or pain. For individuals with conditions like interstitial cystitis or overactive bladder, this irritation can worsen symptoms significantly. Over time, chronic irritation might contribute to long-term bladder issues, but current evidence does not definitively link these irritants to bladder cancer. Maintaining a healthy bladder environment involves balancing fluid intake and avoiding known irritants. Hydration plays a vital role in bladder health. Drinking enough fluids, mainly water, helps dilute urine and reduces irritation. Most adults should aim for about 6 to 8 cups of water daily, which is roughly 48 to 60 ounces. The color of your urine is a good indicator. Light yellow suggests proper hydration, while dark yellow may mean dehydration. Drinking too little can lead to concentrated urine that irritates the bladder, increasing the risk of infections and discomfort. Conversely, drinking too much can increase urinary frequency and put extra strain on the bladder. For those concerned about bladder health, especially if they have a history of bladder issues or bladder cancer, practical steps include making water your main beverage choice. Limit or avoid caffeine, alcohol, carbonated drinks, and acidic juices if they seem to trigger symptoms. Spread your fluid intake throughout the day to prevent sudden urges and reduce nighttime trips to the bathroom. Monitoring your symptoms can help identify which beverages may be problematic. Try eliminating suspected irritants for a week or two, then reintroduce them one at a time to see if symptoms worsen. Maintaining a healthy weight and diet also supports bladder health, as obesity is linked to increased risks of bladder problems. In terms of bladder cancer prevention, reducing irritation from beverages may improve comfort but does not directly prevent cancer. The most significant risk factors for bladder cancer are smoking and exposure to certain chemicals in the workplace. Staying well hydrated and avoiding bladder irritants can support overall urinary tract health, especially for those with a history of bladder issues. Always consult a healthcare professional for personalized advice, particularly if you have ongoing symptoms or a history of bladder cancer. Remember, individual responses vary, and what irritates one person might not affect another. Making mindful choices about fluids and lifestyle can help maintain a healthy, comfortable bladder and improve your quality of life.